Welcome everybody. It's great to be here today with the Customer Service Minister Victor Dominello, our Chief Health Officer Dr Kerry Chant, as well as the Deputy Secretary of New South Wales Health, Susan Pearce, and in addition today Dr Amit Shetty, who is the Clinical Director of COVID-19 Community Care in the Home. I want to begin today by once again thanking our frontline health workers who tirelessly, day in, day out, are ensuring that our community right across New South Wales is kept safe and in receiving the care they need as we get through this difficult time for our state. I believe we have the best health staff anywhere in the world, and they have tirelessly worked to protect the community, not just during this period of time, but over the last 2 years. And that tremendous effort is world leading, and on behalf of everybody across our state, can I thank them, our doctors, our nurses, our paramedics, our OOO call staff, who are doing an amazing job on the front line, looking after everybody across New South Wales. Today, as you'd be aware, we have launched at 9 o'clock this morning through the Service New South Wales app the opportunity for people right across our state who have received a positive rapid antigen test to register that test. We have made a decision as a government that the registration of that test is mandatory, and you will need to register your positive rapid antigen test from 1 January. So if you received a positive test from the 1st of January, you can do that through the Service New South Wales app. This health order has been signed off this morning. And in terms of enforcement, if someone fails to register a positive rapid antigen test, there will be a $1,000 fine, and there will be a grace period. I've spoken to the Police Commissioner this morning, Karen Webb, and enforcement of this fine will come in a week's time. So that's from the 19th of January. The app is seamless. And Minister Dominello will speak to the ease of which this registration occurs. It will only take a couple of minutes. Simple questions in terms of registering your details. If you are registering a positive test for yourself or for someone else, those details need to be provided. And importantly, also the provision of information in relation to whether you have any underlying health conditions, whether you're pregnant, that medical information we are asking for, because unlike other states, what we're doing here in New South Wales, and the importance of this, which Dr Shetty will speak to, is connecting people with care. This is not just about the numbers and the registration through Service New South Wales. More importantly, this is about ensuring that New South Wales Health is connected to those details. So if you do have any underlying health conditions, New South Wales Health can provide that support, because we want to identify any issues in relation to positive cases as quickly as possible. As we know, with Omicron, symptoms are much less severe than with previous strains of the virus, but it's important that we remain vigilant during this period of time. That's why we've made the decision today for the uploading of those tests to be mandatory as we move through this period of time. I also want to make a big call out today for everybody to continue to get your booster shot if you've not done so already and are eligible. Today we've seen a 20.2% of our population who are eligible have received that booster shot. It is very, very clear. Looking at the numbers in ICU, 175 people today in ICU, more than 50% of those people are unvaccinated. More than 50%. Vaccination has been key over this period of time in keeping you, your friends and your family safe. It is very clear on those numbers. They do not lie. We have a 95% vaccination rate here in New South Wales, yet over 50% of people in ICU are unvaccinated. So please, if you have not done so, if you have not received the first dose, please go and do so. If you're eligible for your second dose, please do as well. But there are many people across the state either who are now eligible for that booster shot, and you can have that booster shot administered either at 40 of our clinics right across New South Wales here from Public Health, but also to your pharmacy and your GP. Once again, as I've said in the past, if you received your vaccination through a GP, you can still come to one of our centres and receive that booster shot here in any of our 40 clinics right across our state. So please make an appointment today. It is very clear on the facts, on the figures, that vaccination is key to keeping us safe. The efforts that we've made right across the board, every single person in our state has made enormous efforts and sacrifices to get us in the position we are in today, but we can't rest on our laurels. We need to continue to drive that booster program, and I want to thank everybody across the state who has made that effort in getting vaccinated, but importantly, please register for your booster. As we move through this period of time, boosters will be key to keeping you and your family safe. So before I pass on to others to speak, I just want to say, whilst it's a difficult time in our state, and I know that many people are anxious, we will get through this. We will get to the other side, and we will come out stronger as a state. We have done that twice before, of the Alpha outbreak and the Delta outbreak, and we will do it once again. We are seeing Omicron spread not just around the country, but around the world. Our health system is strong. We have the best health workers anywhere in the country, and we will get through this. We'll get out the other side stronger than we came through. I'm now going to pass to Dr. Chant, who will give us a public health update, then to Minister Dominello, who will provide further information in relation to the registration of positive rapid antigen tests through the Service New South Wales app. Then Susan Pearce will provide an update in relation to vaccinations and boosters, and then Dr. Shetty will provide some information, some important information in relation to the work that he is doing and the teams are doing, and public information in respect of community care in the home. You know, many people across the state are in isolation or who will receive positive tests as we move through the next few weeks. So now I'll pass to Dr. Shan.
So there are currently 2,242 COVID cases admitted to hospital, with 175 people in intensive care, 54 of whom require ventilation. There were 34,759 cases of COVID detected in the 24-hour period, and 134,000 COVID tests. I've said before that we'll be looking at an amalgam of data to inform where we are in the Omicron wave, and that will include hospitalisations, ICU admissions, case numbers, but also the RAT testing data that the community, I'm sure, will embrace that reporting system. In terms of the question about what proportion of Omicron and proportion of Delta, we have been using, one of the pathology companies has uses a testing methodology that tests for the S gene, and that gives us an indicator because in Omicron there's generally S gene dropout. The S gene is not present. So we have been getting some data from that company progressively to track the proportion of Delta and Omicron. And what we're sitting at is about 90% now. So we think 90% of the cases are Omicron, about 10% are Delta. Now that obviously can be different in different geographical areas, but that gives the community a broad understanding. We've also been doing some work to understand the proportion in ICU of both Delta and Omicron. And what we've seen is that early in December, from some of our sampling, and we'll report this in full once all of the genome sequencing results are back, but as an indication, in early December, from the 1st to the 7th, 90% of the cases that we've sequenced in ICU were Delta, 10% were Omicron, and then progressively in the week of the 29th of December to the 4th of January, we've seen that shift to 33% Delta and 67% Omicron. But can I just echo the Premier's comments? The vaccines work. Boosters really improve your level of protection, including against Omicron, and I can't urge you enough to please book in now and get vaccinated. Sadly, New South Wales today is reporting the deaths of 21 people with COVID, 17 men and 4 women. One person was aged in their 30s, one person aged in their 40s, 2 people were in their 50s, 4 were in their 60s, 6 people were in their 70s, 4 people were aged in their 80s, 2 were in their 90s, and 1 person was 100 plus years. 7 of these deaths are historic. 4 were reported since the 23rd of December. 1 relates to a death in September and the second in October. And just to go through the reasons for that is clearly the coroner. We work very closely with the coroner. Deaths are reported to the coroner, so unusual, unexpected, or where the clinicians are uncertain of the cause of death. As you know, the virus can actually be in people's nose and throat for a long time, particularly when we use that sensitive PCR testing. And the coroner has been routinely swabbing all people that are admitted to their facilities and are under the coronial jurisdiction. And in those cases where there's a positive case, the coroner will determine where it's clear-cut. New South Wales Health will report it, but where it isn't clear-cut, we wait for the coroner to indicate whether it's linked at all to the COVID infection, and hence we're updating our case numbers. And that will be a feature going forward, and I just want to thank the forensic pathologists and the coroner for their cooperation in updating those statistics. Again, can I thank the community for continuing to come out and get tested, and also the need to, if you are RAT positive, to isolate. You need to treat that as that you are a confirmed case. Your household will also be required to isolate. And it is important that we take these very practical steps to keep you and the broader community safe. Just want to acknowledge the work of the community in going about their activities in a safe way. I also just want to reassure people that when we were collecting more refined data, when we had much lower case numbers, I just want to assure people that going to the supermarket and those activities are actually very low risk activities, particularly given that people are wearing double masked. You can socially distance, they're usually large venues. And I just want to reassure and give confidence that those activities are low risk, and it is important that the community goes about those businesses, and also some of the retail settings can be quite low risk. So again, we want to support the community to maintain some of those activities of daily living. Thank you.
Thanks, Kerry. Thanks, Premier. Well, as we know, in New South Wales, over 7 million people have downloaded the Service New South Wales app, and in many ways that's their front door key to access government services. And what we've done now is make it easy for people to register their rapid antigen test via the Service New South Wales app. That app went live this morning, that feature went live this morning, and as of right now, 2,903 people have already registered their RA tests. We've had feedback 79 times with a thumbs up of 100%. So it shows that so far it is proving to be a seamless experience. I road tested it myself last night and it was pretty straightforward. Because you're going through the app, all the key details are pre-populated, which is a good thing. But in addition, you can also put your dependents in the same way when you're checking in. You can add dependents. With the RA tests, you can also add dependents via your app. Now, for those people that don't have a Service New South Wales app, you can always go to Service New South Wales website and access the form there. Alternatively, you can go and call Service New South Wales on 137788, and they will also provide assistance in relation to registering the RA test. There's also provision for interstate travellers or people in New South Wales that don't have the app, and there's not many that don't, but those that do not and wish to have a guest account, we've also provided for a guest account to register your test. Now, as the Premier has said, you can register your test from 1 January if you've got the results with you. But as of today, there is a mandatory requirement. Previous to today, we encourage you to register, but you don't have to. But they are available from 1 January to register your tests. And then the provisions of a $1,000 fine will come into place, but the actual mandation comes today. I also would like to encourage people to use their service app where they can, because it really is a seamless experience, and it's what we're doing here that no other state or territory, to my knowledge, is doing. Most other places simply have a web form. We are connecting it to the app, because once we connect it to the app, we can then connect you to healthcare services as well. And that's a key feature of what we're doing here in New South Wales. We're basically stratifying those that have COVID into two categories, those with low risk and those with high risk. And when you fill out the questionnaire through your app, you'll quickly work out whether you're in a low risk or a high risk setting. But over 99% of people will be in that low risk setting and will be able to resolve COVID at home simply by resting and going through the requisite period. Those at higher risk, you will get a call, you will get contacted from New South Wales Health within 48 hours and with a further survey and to make sure that you're okay. So what we're trying to do here in New South Wales is provide a comprehensive environment to not just register your RA tests, but also to provide additional care as required.
Thank you. We remain very pleased with our vaccination program here in New South Wales. Today we can say our New South Wales Health Clinics have given over 4.5 million vaccines since the rollout began in February last year. Already this week for our 5 to 11-year-olds, we've given nearly 5,500 vaccines to that age group in our clinics, and we're delighted to see those young kids coming each and every day, and we expect that number to continue to grow. With respect to the booster program, very pleasingly in New South Wales, 1.3 million people in this state have had a booster. There is nothing better you can do for yourself than get that booster and to protect yourself and your loved ones. New South Wales Health Clinics have given right on what we expected to give in the booster rollout so far. So around 27% of boosters are being given in our clinics, with the remainder given by our GP and pharmacy colleagues. So at present, as the Premier has said, we have around 20% of the eligible population over 18 years of age who've had that booster. We believe that as more and more people become eligible, we will see that number to continue to climb. For those out there who have not yet had their first dose, please come forward. It's certainly not too late. We welcome everybody to our clinics. And very pleasingly, we are seeing people every day come to our clinics for their first dose. We'd love to see the number for 12 to 15-year-olds increase as well, because that has stabilised at around 81.5%. We believe that there certainly are many more kids out there who could have the benefit of the vaccines before the school year commences in that age group, and we welcome them to our clinics as well. Thank you.
Good morning. Thank you, Premier, Minister Dominello, Dr. Chant, and Ms. Susan Pearce. I am Dr. Amit Shetty. I'm the Clinical Director of COVID-19 Care in the Community Program. There has been a change in the way we test and manage COVID-19, with rapid antigen testing now being accepted as a form of diagnosis for the disease. Most people will be able to diagnose themselves at home, as has been announced. We know that with the current vaccination rates in New South Wales, along with the majority of our cases that Dr. Chant highlighted, are now of the Omicron variant. Our ICU rates and hospitalisation rates are proportionately lower, and our systems, even though they are in significant pressure at the moment, like the Premier highlighted, is the best in the world, and I'm proud to be a part of that. To help us manage the large number of cases, we have set up a process which Minister Dominello highlighted, where people can register their positive test, they can complete a survey-based risk assessment, and be provided with the advice they need to care for themselves, and majority of the people will belong in that low-risk group. As highlighted, the system has been tailored to identify those people who are considered to be at a higher risk of developing serious disease from COVID-19, and also those who qualify for therapy given early in COVID-19 so they don't end up in our ICUs or hospital. The process essentially, as highlighted by Minister Dominello, is 2 surveys. The first one delivered in the Service New South Wales app, and through the web link. And the second one is then sent out through New South Wales Health. So essentially, once you register, you're linked into New South Wales Health, you will get a notification that you've been tested positive, and you will also get the isolation notice with the same thing. One of the other things we put in place, because we know the community has had significant concerns about de-isolation, is that within the next 24 hours, there will be a second SMS sent with a post-dated de-isolation notice. So you will be getting that pretty much in the next day itself, so that avoids you from having concerns. We've noted a lot of people raising concerns about the de-isolation date, so we'll be providing it actively to them. The people who are likely to need additional help are those with significant health problems that impact the heart, lungs, kidney, and the immune system, and especially those with active cancer on chemotherapy. People who identify themselves as Aboriginal and Torres Strait Islander people will be connected with their relevant medical care models in the districts. New South Wales Health will now only be contacting people who escalate to this process, and also the phone line process, which is in parallel for other people who cannot access the digital pathways. The information is already provided to the GPs. The health pathways have been updated for them, and there are hotlines available for people to access this information if they can't do it themselves. But we believe that most people won't have to reach out. They will be able to manage their symptoms at home with the information that we provide at the end of the survey. There's a whole list of resources that will be provided on the survey. And this information is also available on the New South Wales Health website in various different languages as well. The thing is, if your condition changes suddenly and you develop severe symptoms such as severe chest pain lasting for more than 10 minutes, breathlessness that stops you from getting out of bed and going to the bathroom and getting really breathless, fainting episodes, these are symptoms where we would like you to call the 000 and potentially save the 000 for those serious cases. People who have received a positive RAT antigen test in the past 7 days from health advice are advised to register, because you could possibly qualify for the early treatments for COVID-19. I'd like to thank the teams, the community care teams of New South Wales, who have been trying to keep patients as safe as possible in their home settings since the beginning of the pandemic. The patient experience team in New South Wales Health, who has worked closely with Department of Customer Service and Service New South Wales, and the clinical leads of all the community care teams who have worked tirelessly over this period, and also in building this whole program so we can keep people of New South Wales Health safe in their home settings. It's all about us being prepared, vaccinated or not. We could all potentially get COVID. But if you had 2 vaccine doses and a booster, your chances of ending up in hospital or an ICU bed are extremely unlikely. COVID is here. It's something that is becoming more common, and we need to make sure that our health service is available for the people who need it most. You should use the Service New South Wales app, report your rapid test, complete the survey questions to your best of your knowledge, and ensure that your contact details is correct so New South Wales Health can get in connect with you if you belong in that high-risk category group. Thank you very much.
So 2 things I'd say in relation to that. Firstly, we're still seeing on a PCR testing substantial amount of PCR tests occurring across our state, and that's incredibly pleasing. And the success that we've had here in our state has been the efforts that people have made right across New South Wales during this pandemic. We asked people to go out and get vaccinated. They have done in record numbers, 95%. Once again, we're at the point where we're asking the people of New South Wales to continue to make those efforts and to upload those tests. Now, we've asked those tests to be uploaded from 1 January, but more importantly, what we're focused on is the last 7 days, because obviously with a period of 7 days, and that's the time period that people we ask isolate for once they have had a positive test. This is really about making sure that health have access to the information they need in circumstances where somebody tests positive, has underlying health conditions, or who is pregnant, that support can be provided. And whilst this process has taken longer than other jurisdictions, I believe it is the best process because we really want to ensure that people are connected to the healthcare system who need it. I believe as we work through, and what we'll do towards the end of the week, is separate out the positive PCR tests with the positive rapid antigen tests. So they will be separated out later in the week, and that will give a greater picture of where we sit in terms of the current numbers that are coming through with the Omicron variant.
Premier, PCR tests are effectively obsolete as a mass diagnostic tool to find out how much...
Sorry, James, I missed the start of the question.
So PCR tests are effectively obsolete in terms of finding out how many people have COVID in the unit count, right? Because the test results taking so long, people aren't lining up to get the tests so they need to confirm their RATs. Why is the government still paying so much for PCR tests and not paying for tests that people are actually using? And when are you going to start doing that?
Well, we're still seeing on the PCR tests, what we are seeing is still significant testing occurring across our state, and that's positive. The PCR tests will continue to support the rapid antigen tests program as we move into the next phase of the pandemic. When you're in a situation where we have high case numbers, then as we've seen over the Christmas New Year period, that puts substantial pressure on PCR testing. And in addition to that, it takes a lot longer for those tests to be returned, not just because of the numbers who are being tested, but in addition, as we've heard earlier, due to the pooling arrangements, we're in a very different situation with testing than we were back last year during the Delta outbreak. So I see the PCR tests being complementary and continuing alongside the rapid antigen tests. My expectation to your question would be, as we've now seen more rapid antigen tests arrive in the country, that this will become part of normal life as we head through 2022. Now, clearly supply is still a challenge across the country. We've, as you know, have put an order in for 50 million and are procuring an additional 50 million. In the main, they will be used to support essential service delivery here in our state through our schools, transport, and health workers. So that will provide a continuity of service delivery in the state as we move through the next phase. But we're also seeing our private supply chains also come on board, and my expectation would be, as we move through this next period of time, supply will increase, but I still see a role for PCR testing moving forward.
This is all a bit useful so people, one, can even find a test right now, and secondly, if they can afford a test. A lot of people cannot afford to buy these tests. They will never do a RAT. They will never be checked on your system.
Yeah, and that's why I do believe we need to continue the PCR testing moving forward. Both systems working together will assist high levels of testing, and we will continue to work with the federal government in relation to those provisions of rapid antigen tests. From a New South Wales government perspective, we are already reaching out to vulnerable communities, in Aboriginal communities in remote and regional New South Wales by taking out rapid antigen tests in that space, and also through social housing. We see a role that the state government can play in ensuring that those who would otherwise not be able to access a rapid antigen test
there
get
are a whole
one.
bunch of regular folk who aren't in the vulnerable category, who have to make the decisions about whether they pay for a doctor's visit, the meat for this week. A rapid antigen test at $30 a pop or $25 a pop when you have 4 children or 2 children is impossible.
And that's why we're continuing the PCR testing. And we're still seeing substantial amounts of testing occurring right across our state, just without the queues. The queues are being alleviated because of the rapid antigen test program, and that's why we continue to provide those free tests here in New South Wales at a 50-50 funding arrangement with the Commonwealth government, and that PCR test, those PCR testing centres across our state will continue to operate. But we will see the burden on those centres, as we already have, be alleviated as rapid antigen tests continue to increase across the state.
His health advice is explicitly telling people to do a RAT, not a PCR. That RATs cost $25, $30 people can't find it.
Now, what we are saying is that if you've had a positive rapid antigen test, you do not need a PCR test. What that does is ensures less pressure on PCR testing, and those who cannot access a rapid antigen test, to Eddie's question, for whatever reason, that those PCR testing clinics are available. And that's why it's even more important as we move through. If you do have access to a rapid antigen test, then you don't need a PCR test. That's what's important. We don't need a duplication of the system. They need to be complementary with each other.
Premier, are you looking at a system of vouchers to help people purchase a rapid antigen test? If so, why? And wouldn't it, if you are, would it not just be easier to provide people with a rapid antigen test rather than a voucher to go out and buy one?
No, it wouldn't, because the advice that we've received is very clear, and that's come through the National Cabinet, is it's important as we move forward that the private supply chains remain in place, and that would be compromised through such an approach. I certainly, and from the government's perspective, are looking at ways in which we can help the broader community in terms of the cost of those rapid antigen tests as we move forward in a way that maintains those private supply chains. One of those options that we are certainly looking at is a voucher system that would be supportive alongside the provision of those tests through a pharmacist and a supermarket, but we're working on that now. We're looking at the feasibility of doing that. In the interim, what we're doing is making sure we are procuring rapid antigen tests to ensure the continuation of service delivery here in our state, and they are in the key areas of schooling, transport, health services, that we make sure that the workforce has access to those tests when they need them.
Just on those self-purchase rapid antigen test, a supermarket or a pharmacy, it's like a Hunger Games system out there at the moment because people are desperately trying to find them. In December, you said that people would be giving them for free. When does that distribution start for people that are not as vulnerable?
Well, the first question is I have not. Obviously, it's very clear across the state that there is a shortage of rapid antigen tests. As I have said, my expectation would be nationally, as states and the federal government roll out their procurement program, that we will see greater access to rapid antigen tests across the board. What was the second part of your question?
You mentioned in December, on December 25th.
So we have, as I've said, already started to see the commencement of arrivals of our rapid antigen test orders that we've put in. So we've placed an order for 50 million. We're placing an order for 50 million more. And we will work through the provision of those tests in areas that we see appropriate. We currently have Minister Ayres, the health team, and the Department of Premier and Cabinet working through whole of government approach to making sure our frontline workers here in New South Wales have access to those tests. But it may not be just simply our frontline workers. We will provide those tests in circumstance that supports service delivery across the board. And once that has been determined, as those tests come in, we'll make those announcements.
How many of those tests have you received delivery of so far, Premier? Has it just been that one batch, and how many were in it? And have people actually started receiving them? If so, who?
Well, we've already started an outreach program, for example, to remote Aboriginal communities in relation to the provision of rapid antigen tests. We obviously have provided rapid tests for our health system, and in terms of the actual numbers, I'll get you the exact figures that have arrived, but there's a number that are arriving over the course of this week and into next week.
But people have got them though. People are using them, the ones from your stockpile.
Yeah, but at the moment, those tests are going out to remote communities and also to help our health system at this time. But as more come in, we'll have more to say in relation to the provision. But it's not a rush to get them. It's making sure that where we put them are areas that are actually going to continue to support service delivery in this state. And I see potentially schooling as a crucial part of that.
Premier, just on those penalties, how are people from non-respecting backgrounds expected to comply? It seems that they could be unfairly targeted by these fines.
I have complete faith in our police force in terms of managing those issues, and I think one of the great successes over the last 2 years in New South Wales has been the role that the police force have played, and I think they've been incredibly reasonable. Community policing is crucial, but also in providing awareness. It's not simply about enforcement, it's about promoting and encouraging and communicating, and the police force have done an amazing job here in our state over the last 2 years. That will be supported also through the work that Multiculturalism in New South Wales does in that space. I know the Minister is already working through, whether it's through clear communication in relation to the rapid antigen tests, in terms of the booster shot program, and now in relation to the mandatory requirements to report, that clear communication will be delivered and communicated clearly to those ethnically diverse communities across our state, who, can I say, from the leadership of those communities, have played a crucial role in ensuring we've had the vaccination rate here in our state that we have. There were many concerns early on in terms of the question you're raising about getting that communication out. Well, the facts speak volumes, and that is that we have a high vaccination rate right across the board, particularly in our ethnically diverse communities, and that's testament to community leaders and Multicultural New South Wales, who will continue the work of the past as we move through to the future. Eddie. Yeah, we are committed, completely committed, that schools will be open day one, term one. And community sport. There is no reason as to why those activities would not continue as we move through. Having said that, I accept that there's a lot of people right across New South Wales who are anxious at this time, and people will make their own decisions in relation to sport, particularly. But when we announce our school plans, there's areas within those plans that we're focusing on in terms of activities within schools that we may limit early on as we move through. But for every parent across the state, our commitment as a government is to open schools day one, term one, in a way that is safe for teachers and for kids.
What about visual support? Is that on the table? Are you going to help with this?
I know that the Treasurer is currently working very closely on this, on economic support. At the moment, we want to make sure, just with all our other packages, and as the former Treasurer of this state, we always made sure that when we did make those investments, they made a difference, that they actually got to the businesses, they were actually targeted in a way that kept businesses going and kept people in jobs. And we are completely committed to doing that. This is a very different phase of the pandemic. Last time we had lockdowns, we had businesses across our state, almost every business, the frontline business, closed. And we needed to provide support for reopening. Different situation now, but the right decision on behalf of governments around the country to keep society opening alongside a highly vaccinated population, but it brings other challenges. And we are seeing businesses forced to close temporarily because of staff shortages as more people are forced into isolation. So it's a unique challenge. I've certainly been meeting with business leaders, understanding those concerns. It's not about the rush to get a package out. What's most important is understanding that as we move through this next phase and as the wave comes down, where the best investment from the state will be to keep businesses open and to keep people in jobs. And our success as a state and as a country more broadly has been an incredibly low death rate compared to the rest of the world, whilst at the same time a strong economy and getting people in jobs. And that is our commitment. That's what we've achieved over the last 2 years. The confidence is low at the moment, but confidence will return. When case numbers subside, confidence will be back, and that will drive our economic recovery, just like it has done over the last 2 years.
Dan.
Oh, sorry, Chris.
Chemists are screaming out because of a lack of supply. Some are themselves driving around the state trying to source it. Does this place your plan for getting back to the schools, though, in jeopardy? If the parents can't even get the kids out.
No, it doesn't. I mean, and Susan might make some further comments in relation to this, but it does not. We know that they're either through our centres or through GPs and pharmacists that vaccines are available for 5 to 11-year-olds. There may be, as I've said with opening schools, there may be bumps along the way. We also know with young kids that with the Omicron variant and with COVID, that symptoms are less severe. But no, it is not an impediment. It is not an impediment at all. We are going back to school on day one. In terms of supply, we're working very closely with the Commonwealth Government, but I might have Susan just make some further comments in relation to pharmacists and GPs.
We had our regular weekly meeting with the Commonwealth yesterday, and they confirmed that the supply will improve, particularly between now and next week. So we're hoping to see some of those issues that have been reported resolve. We've been working really closely with GPs and pharmacies ourselves, and at times we do assist some of those other providers with vaccine where we can. But obviously we can't do that in a large-scale way. We've got to manage our own supply, but certainly the Commonwealth are confident that that situation will improve.
The problem that the chemists are saying is that these announcements are being made. Announcements about RAT, announcements about kids' vaccines, but the system's simply not ready to go. They're saying there's a consistent problem there. It may lay with the federal government, but there's a consistent problem.
Look, the matter I'm sure the Commonwealth would have a comment on. The Commonwealth supplies and distributes the vaccines right across the state, including to our clinics. What we can say about our clinics is that our supply is sound, we're in a good position and we'll continue to play our part. We expect to see that situation improve in the next week.
Premier, just on, you mentioned day one, term one for schools. It's been your consistent position. Some parents, though, are not necessarily as confident as you at this point. So going forward, will you be requiring children to return to school day one, term one? Will it be mandatory as it normally would be during the school year for students to be in class? And for parents who don't want to send their kids to school, will remote learning be available for them?
Well, Dan, the point I'd make is schools will be open day one, term one. We will open them in a way that is safe for kids and safe for teachers. Now, I understand, as you quite rightly point out, that there are probably two schools of parents, some that are very concerned, some that just will do anything they can to get their kids back into the classroom. But we will work through those issues. I've sat down with the education team again yesterday, almost daily conversations as we finalise those plans. And we've also got to accept that the situation is moving every day here with the Omicron wave. So where we sit today may be very different to where we sit at the end of January, and we're working through those plans. National Cabinet meets tomorrow. We will see where we get to in relation to reaching agreement on some broad principles in relation to getting kids back to school. But school doesn't go back for a number of weeks now at the end of January. So my position and what I'd like to communicate to parents is that we will have schools open on day one in a safe way. Now there will certainly be other logistical challenges that come our way through this. It will not be smooth sailing. There will be bumps along the way. I can assure you of that. We saw that last year when we brought schools back early. In the main though, when we brought kids back into the classroom, whilst we had some school closures from time to time, the majority of schools, the vast, overwhelming majority of schools stayed open and kids were in the classroom. Kids being at school is one of the most important things we can have happen in New South Wales. As we move through this phase to a more endemic phase, and COVID becomes more normalised in society, there are aspects that need to continue, and schooling is crucial. The impact of not having kids in the classroom will be substantial in terms of the impact on the child's educational outcomes in the future. So on my list of things that we're working on every single day, hospitalisations is number one, and number two is getting kids back in the classroom. I am passionately committed to doing it. I completely disagree with the doctors' union in relation to this space. We need kids back, and we need them back on day one, and that's what we're going to do.
Premier.
Yeah. Yeah, it's going to be a challenge. It's going to be a challenge. Now, when it comes to childcare and early childhood education, that was a topic we certainly discussed yesterday with our education teams. Very much aware of pressure on that system right now, which will only grow as more people go back to work as we move through the summer period. There's no doubt there's going to be a challenge with a furloughed workforce. That we've got to do what we can to keep the classrooms open. And last year we did see towards the end of the year a number of classes close, even with higher numbers. Based on the plans we put out, I believe that number that will be less of an issue this year than it was. I believe it to be less of an issue this year than it was last year. But there are challenges in every workforce right across the state, and we've just got to push through. We just have to keep going through this difficult time. The alternative is to stop. The alternative is to close down. We can't do that. This is a global pandemic. We're all going through a difficult time, and our people continue to stand strong, and we're going to push through. We pushed through the last 2 years. There is no alternative here. Does that mean that there won't be disruption? No, it doesn't. There will be disruption as we move through this. But if we continue to make the efforts together as a state, we're going to come out stronger the other side, and the future's going to be incredibly bright. Now, for many, I accept that may be hard to see right now, but we're going to get there. And yes, there'll be hurdles, but we've just got to push through and know that the entire government, from the cabinet to the public service, right across the board, everyone is working day and night on every area of government to make sure, as we approach these challenges, we do so in the most seamless way possible for everyone right across our state. Tom, and on the
penalties to 1,000.
yeah.
How are you actually going to enforce that? How do you prove that someone hasn't reported a positive RAT? You're not actually going to be finding that way.
Well, I've spoken to the Police Commissioner this morning in relation to this. There are obviously areas right across the state where there are laws that are harder to enforce than others. This is clearly one that will be harder to enforce. There's no doubt about it. The alternative, though, is to not make it mandatory. That will discourage people from actually uploading a test. We want people to upload their positive test, particularly those who have underlying health conditions, particularly those who may be pregnant, because that information needs to be provided to New South Wales Health. So the alternative was not to mandate and to encourage, but that would be a worse outcome than being in a position where we have a mandate in place. But I expect everybody across our state to upload the test. We asked people to go and get vaccinated, and we have done so in record numbers. We've asked people for the last 2 years to get tested if they have symptoms, and they have done that in record numbers. The government has set that direction, but our success in our state is not because of the government, it's because of the people of New South Wales. We have a situation in our state where we are leading the nation out of the pandemic because of the heroic efforts and sacrifices of everybody across New South Wales. So our message today is we've just got to continue that effort as we push through this next period. And if you've had a positive test, please upload it. It takes about 2 minutes, from what I'm told. I flicked through it today. It looks pretty simple in terms of the way it's set out. It'll take a couple of minutes, but it will make a real difference in getting that information that we need to New South Wales Health. And by doing that, in providing those numbers, we can ensure that information to New South Wales Health is provided in a timely way to keep people safe. So if we can continue to all do our part here, we'll ensure we get through this next period of time safely.
Some popular experts said that scrapping the mask mandate in December would have aided the not scrapping the mandate would have aided the state in those rising cases. Do you think that scrapping?
No, I mean, we will always, as we've said from the outset, as Premier of this state, in every press conference, we tailor our settings on the evidence and the circumstances that are in front of us. And we are seeing escalating cases right across the country. We are seeing escalating cases right across the world. Now, I remember being with the former Premier during the Delta outbreak and the Alpha outbreak, and there are always opinions in press conferences from epidemiologists, from the media, in relation to every single response the government takes. There are always opinions, there are always different views. But as a government, we will continue to do what we believe is right for the people of our state. That has been our success as a state through the last 2 years, and it will be our success as we move through. And there is no doubt that New South Wales has one of the lowest death rates in the world through this pandemic, and our economic position here in our state in not just keeping businesses open, but in terms of instilling confidence. There's no doubt confidence takes a hit. When case numbers are high, when there's a disease in the community, when you're in lockdown, confidence takes a hit. But every single time in New South Wales, confidence returns, and it comes back strongly. That's exactly what's going to happen here.
David Elliott has, your senior minister, labelled the decision to give MP 23 RATs was stupid. Have you got your 3 RATs in your elected office? Will you donate them to the community, and do you expect other MPs in the Liberal Party to do so?
Yeah, I haven't been to the electoral office this morning to check in on those tests, but look, I don't think the delivery of those tests was necessary at all. I think that most members of parliament in the main should not be going into high risk settings. Now, there may be an exception in certain circumstances, and my view would be to those local MPs who are going into a high risk setting, if they are required to for official purposes, then they should have a rapid antigen test, and they should do that test before they go in. Now, it may be the case with a member of parliament in the course of their official duties that is required. I would expect, in the main, that members of parliament during this period of time would not be going into those settings.
What setting?
A health setting, aged care setting, social housing. There are a number of settings where, but members of parliament, it would be the exception rather than the rule that a member of parliament would be going into one of those settings at this period of time. So my view would be that members of parliament who are not going into those settings should distribute those rapid antigen tests to areas in their community, those frontline areas in the community that need them. And I think it's a very sensible position that David Elliott has taken.
Just really quickly on hospitalisations. We are seeing that...
Yeah, so one question here, and then we'll go to Dr. Chan.
Yeah, just on hospitalisations, we are hearing from staff members, and they're not needing a triage unit set up in an emergency day car park at RPA yesterday. What are you doing to get a handle on the situation?
Well, that's an operational matter. I'll pass to Susan in relation to that. But look, there is no doubt that the health system is under pressure. We're in a pandemic. The health system is always going to be under pressure. It was under pressure under Delta. It's under pressure now. We have the best health staff in the country who are working tirelessly every single day to keep people safe. But in circumstances where you're in a pandemic, there will be pressures. But I know, and Susan will make some comments here, that our health team is working day in, day out, from hospital to hospital, looking at this right across the board to alleviate as much pressure on the system as possible. But I might get Susan to speak a little bit. And then Eddie to carry.
Thank you. Look, the health system obviously continues to be under really significant pressure at the moment, as we predicted. We'll have more to say later this week in terms of how we're tracking against the model that we released last week. So at every hospital, we are trying new things and new ways of looking at how we can help our staff combat the pressure that they're under at the moment. We'll continue to do that. I know that at RPA, the executive team are working really hard to assist the staff, including, for example, going onto the wards to relieve them for meal breaks. So that's managers coming out from behind their desks and going to work on the wards, which I think is a really positive signal to our staff. But can I reiterate, our system will continue to be under pressure. at least for the next few weeks. We've already made that comment, and I would just ask people to be patient and kind. Our staff out there at the moment are doing their level best to deal with this situation, and we're going to support them every step of the way.
Last question. How concerned are you about the effectiveness of rapid antigen tests, given that the TGA is now doing a review of them?
I think I would direct people to the website, which sort of looks at the way we want RAT tests to be used. And part of our issue is we're going to have to accept that PCR testing is a finite resource, and what we actually want is the right patients to be having access to that, where they're going to benefit from it. And so that's the purpose of the switch in a mixed testing strategy. And I know that's been a sudden shift, and we do need to get that information out. So there is information on our website about how to use it and in what circumstances. We do want doctors to be able to refer people for a PCR test where they absolutely want to know, because RAT tests can be false positive, and in that circumstance the person might actually have some other underlying disease that needs to be treated. And so we do expect that escalation. So if your condition's not getting worse, linking into care, if you've got those chronic underlying health conditions, we want you to seek advice, because we know that there are, with any test, there are interpretations that have to be made, and you're best connected to your clinicians.
A number of false negatives on rapid antigen.
We would expect,
and then a positive on a PCR.
we would absolutely expect that, and there's going to be two factors. PCR, the RAT testing is less sensitive, so you're not going to pick up when you're just becoming infectious. Even when you're symptomatic, if you read our fact sheet, it says even if you get a negative PCR and you're symptomatic, stay home and do a repeat one the next day, or get a PCR. So we're very clear with the fact that the tests need to be taken in context. If you're a household contact of a person that's got COVID, you have got COVID even if you've got a negative test, and that's why we say household contacts, stay in there isolate for 7 days. It is really complicated for the community. We have tried to update a fact sheet with more infographics and try and do it and we are doing some videos in language and translated material. We just have to keep supporting the community to understand when to use a RAT test, when to escalate care, and when a PCR test may be relevant.
Dr. Chan, as a public health official, how does it make you feel that you're asking people to use a $25 test as a crucial diagnostic tool, and you're effectively asking people to go out and pay out of their own pocket for something that's off the shelf that you can't find or love nor money? Do you think they should be free?
What I'm hoping is happening at the moment is the people that have RAT tests are using that and freeing up capacity in our centres to actually achieve the testing rates in the areas we want. I look every night at the testing rates in some of the suburbs, and it's really pleasing in southwestern Sydney that our testing rates are holding up very high. And that's not a generalisation, but I do look at southwestern Sydney and western Sydney where we're getting a number of our cases, and it's pleasing to see that clearly I look at testing rates as well as the cases that are positive. But I want PCR being available for those that haven't got access for RAT. I want people with underlying health conditions particularly to have access to PCR where they haven't got a RAT available. But we don't want delay. There is no point in having a situation where test results are 4 days later when you've already had symptoms for 3 days and you miss out the benefit of having some of the therapies. And that's our critical issue. Don't delay. Get a test, whatever test, as soon as possible, and please take the action as described. I know it's confusing. I know it's been really messy. This transition's been quicker than we've ever wanted it to be, but it is the case that we are transitioning, and we sometimes have to use the best of both worlds. But we do need to get the community to understand both the fact that tests can be false positives and false negatives, and to take into account their circumstance. As I said, if you've got symptoms, do not go out and about, even if one a single test.
Private hospital images in the hospitalisation numbers for COVID?
That would be addressed by Susan.
Sorry, could you repeat the question?
Are you counting private hospitalisations in the hospitalisation data on COVID at the moment? Transfer from a public
At this particular point in time, we haven't moved any COVID patients to private hospitals.
You said on Monday that you were beginning to transfer people from public hospitals to private.
Yes.
Is that not correct?
Yes.
And are they then counted?
They're not COVID patients.
Okay, so they're not COVID.
Correct. Yeah.
Just really quickly on multicultural communities, we spoke about before. Some community leaders in these communities are being overwhelmed with questions from the committee about these health rules that are constantly changing. You're engaging in
Yeah. So what was the concern?
So some multicultural community leaders are saying that they're being overwhelmed with changing health messages.
Yeah.
And those changes.
I know the Minister is working and has been working very closely on this through Multicultural New South Wales. As Dr. Chan has just said, this has been a bit of a rapid transition right across the country, and we've had to make certain changes, and the messages need to change with that. And I know they are working on not just the engagement with community leaders, but also working with them to provide clarity of communication in respect of the changes that have been made. So rest assured, we know our success as a state over the last 2 years has been in clear, coherent messaging to multicultural communities right across the state. That is continuing now, but there's obviously been a number of changes as we've moved through what has been changes to rapid antigen tests, changes to PCR testing in the queue, and trying to reduce and alleviate queues. Today's announcement as well, but I know that the Minister is working very closely to do that, because we know that's been our proven success in the past. But naturally, as you make changes, inquiries and questions come in. Just like we had the same issues last year, but you have a spike of those concerns and then you alleviate them through clear communication, and that's what we're doing.
Sorry, Premier, briefly on the vaccination rates. You mentioned our state has got a 95% vaccination rate. Technically speaking, of course, that is only 16 plus. And that original figure was set up, we were only doing 16 plus because that was the eligible population.
Yeah.
So it doesn't take into account the 5 to 11-year-olds, it doesn't take into account the 12 to 15-year-olds.
Yeah.
Is it time to recalibrate how we describe the vaccination rate in New South Wales to properly reflect now the true eligible population?
Well, I think I'll get through to about that earlier, so I'll get Susan to make some comments.
Certainly we can and will report that figure happily. New South Wales, even compared to the rest of this country and compared to the UK, the US, you name it, our vaccination rate on the whole of population is substantially higher than most other countries. The exact number I don't have off the top of my head, it's around 78 or 79%. So when you look at the UK, you look at the US, on a whole of population basis, we have a very, very solid vaccination rate, which obviously will now improve further with the eligibility of those 5 to 11-year-olds. And I expect that we'll see the same with that age group that we saw with the 12 to 15-year-olds. I think there'll be a really rapid uptake of vaccination in that age group. If I could just comment, just coming back to your question, when and if we do move COVID-positive patients to private hospitals, we absolutely will report those in our numbers.
Thank you all.
Okay, thanks everyone.
Thank you.
Oh, yes, sir.